Hi, I'm Ted Kruse with Physical Therapy Solutions, and today I'm going to talk to you about diabetic neuropathy. Diabetic neuropathy is something we do see at time to time in the physical therapy clinic. Oftentimes we'll come across a patient that is in for a different injury or ailment, and we'll get to talking and teaching them about diabetic neuropathy. Diabetic neuropathy is foot pain, typically related to having prolonged high blood sugars with diabetes. We often see it in patients that are a little bit older, so they've had diabetes for a longer period of time. Patients usually in their 50s, 60s, or 70s. And over time, they start having more and more foot pain, maybe up into the lower leg as well. Along with that they can have impaired sensation. Both of those things can affect their daily life. It can affect their sleep. It can affect their ability to perform their daily activities, weight-bearing activities. It can affect their balance if their sensation is impaired. There's not a lot we can do particularly to help with that pain related to diabetic neuropathy. But what we can do is help with some of the symptoms. Number one, we can educate the patient on what's going on and why, which is helpful. We can help to monitor their sensation by checking sensation in their feet upon our visits, seeing if there's any change there or if it is worsening. And then we can also work on some of the symptoms that go along with it. Like I said, balance can be affected, and the last thing we want to see is where people are at risk for falling. So by working on lower leg strength, flexibility, we can help their balance and hopefully decrease their risk for falling. Another thing we can do is we do have some modalities that can assist with pain. We found that infrared or increasing blood flow to their feet and their extremities with use of what we have as an infrared light machine helps to increase blood flow to the feet, and sometimes that can help to decrease their pain and sometimes their numbness. So that's something we'll try, and if it works, we can go down that path of them using that more on their own. Lastly, we can also, like I said, educate the patient, but also help them manage their pain. Some things that we do find are external forces like stress can have a negative effect on our pain. So if we can teach the patient about that, some stress relieving options or opportunities for them to help control that can bring their pain down and hopefully make it more manageable for them with their daily life. If you have more questions on diabetic neuropathy, feel free to give us a call at Physical Therapy Solutions at our Manchester or Dyersville location. Thank you.